Hello, my name is Joshua Underhill. I'm a general surgery resident at Rush University Medical Center, and I'd like to thank the Society for the opportunity to present our results. Where's my next button here? I'm clicking the mouse, but I'm not going anywhere. There we go. Neither I or any of my co-authors have any relevant disclosures to report. What's my button to go next here? I'm supposed to be using this? Oh, there we go. All right, so a diverticular fistula is a pathologic connection from the colon to another organ, which occurs as a result of diverticular disease. This is generally considered an indication for surgery. However, the literature is pretty scarce about the epidemiology of this disease process. There's some literature that suggests it is less than 0.1% of diverticular admissions, but it could account for up to 9% of indications for surgery in patients with diverticular disease. The goal of our project was to define the prevalence and demographics of fistulous diverticular disease on a national population level. In order to do this, we used the 2018 National Inpatient Sample, which is a healthcare claims database that has a sampling of 20% of the admissions of all hospitals that participate in the Healthcare Utilization Project, which includes hospitals that are public, private, and academic. We used ICD-10 codes in this NIS in order to identify patients who had diverticular fistula, other diverticular disease, and for patients who underwent associated surgeries for diverticular fistulas. We then compared the demographics between patients who had diverticular fistula and non-fistulous diverticular disease, as well as those who underwent surgical versus medical treatment for diverticular fistula. Of note, the data we present here is updated to the newest year of NIS, which is 2018, though at the time of submission to SAGES, we only had 2017 available for our group. So here we had, of over 7 million admissions in the NIS database, a little over 100,000 were for diverticular disease, which is 1.7%. And of those, 3.1% were for diverticular fistula. When comparing patients with diverticular fistula to those with non-fistulous diverticular disease, we saw that patients with fistula were more likely to undergo surgery and to be admitted electively, and also had longer lengths of stay. They also were slightly more likely to be female and to be younger than their counterparts without fistula. For patients who underwent surgical treatment of the fistula compared to those who underwent medical treatment, we find that surgical patients were more likely to have an elective admission and to have a longer length of stay. They also were slightly less likely to be female and slightly younger than patients who underwent medical treatment. The limitations of this study include its reliance on retrospective administrative data, as well as ICD-10 coding, which is often completed by non-clinical personnel, which can introduce some systematic inaccuracies in the data. In conclusion, we see that diverticular fistula is a rare diagnosis, but is more common than